Hello, my name is Michael Phillip, and I'm a physical therapist here today to talk to you about fall prevention. Did you know that one out of every three adults over the age of 65 falls every year, and it ends up costing us $35 billion annually in fall-related injuries and deaths? So it's a pretty serious problem that we need to address. And did you know that most falls actually occur in your own home? So that's the first place we're going to take a look at when we talk about fall prevention. What you want to do first is walk around your house and make sure there's adequate lighting around the house, especially in potential fall areas like stairwells. Another thing you want to do in a stairwell is make sure you have rails on both sides. A lot of times they only have one, but if you're leaning, looking, you're distracted, and you go to fall and there's nothing on the other side, that could cause a catastrophic injury. Other things you want to do is walk around and see if there's any obstacles that you can trip over, any loose rugs that don't have a mat underneath that keep it stuck to the floor, cords, electronic equipment sitting on the floor, toys, anything like that can be a fall hazard that you need to make sure you clean up, especially if you have somebody around the house that's prone to falling. And if you are prone to falls, one of the first things you want to do too is check with your physician. You could be taking medications that could be causing drowsiness, dizziness, or fainting as a side effect. So you want to make sure those aren't the cause of the problem. Another thing you want to do is make sure you're getting plenty of exercise. Exercise helps keeps the bones, muscles, and joints nice and strong. So hopefully you can prevent yourself from falling in the first place, but if you happen to fall, you can better brace yourself so you cause less injury to yourself. And if you would like to start exercising but just don't know where to start, that's when it might be a good time to stop in and see your physical therapist. As physical therapists, we're trained in balance disorders. We know all about them and how to correct them. Basically, when you come to see us, we're going to assess your balance, then we're going to figure out a plan personalized to you to correct that balance deficit. So we're going to put you through some balance exercise that's going to kind of challenge your balance, which is good. The more you stress those balance receptors that are in your muscles and joints, the better you'll become at maintaining your balance. And if you do start to lose your balance, the better you will be at correcting your balance. Another thing we're going to be doing in physical therapy is strengthening exercises, not only for your muscles but your bones as well. Have you heard of osteopenia or osteoporosis? Well, basically those are disease patterns that most often affect those older adults, and basically what it does is it causes brittleness of those bones. And it's been shown that weight-bearing exercises can significantly reduce or delay the onset of these two diseases. And then there's the muscle strengthening. We want strong muscles because basically if we do fall, we want to prevent ourselves from hitting the ground. That's what causes the most injuries. So we want to be able to grab that handrail if we slip and fall, or if we trip over a carpet or a rug, we want to be able to quickly step with that other leg in order to prevent ourselves from hitting that floor. So there you have it. Those are the three things I would think about to help prevent falls in yourself or a loved one. First one, check your house. Second one, go see a doctor. Make sure your medications aren't interfering. And then third, see your physical therapist. We can show you the right things to do in order to help prevent falls. And if you do fall, we can prevent it from being serious. So that's it for this time. Check with us next time for more informational videos. See you soon.